Hello, I'm Mark Chataway. I'm the managing partner for global health in Europe, Middle East, and Africa at Fin Partners, which is an international consultancy focusing on policy analysis and change and on communications. Really excited about the executive forum this year because we have four great speakers confirmed. And the exciting thing about it is they come from a range of backgrounds. So we have Mary Beth Powers from the Catholic Medical Missions Board, one of the most innovative of the faith-based groups, looking at how to deliver care in really challenging settings. We have Patricia Vaughan, who is the president of the Population Council. And the Population Council is fascinating because within itself, it brings together public, private, and voluntary partnerships. So they're a product developer, they're a service implementer, and they're an advocacy organization. We have Alison Neal from Henry Schein, who is also head of the Henry Schein Foundation. And Henry Schein is a great example of a private company that works with lots of government and voluntary players to improve primary and dental health. And we always forget about the importance of dental health in things like cardiovascular disease and prevention of preeclampsia. And then finally, we have Daniel Hallstrom, who's the president of the GE Healthcare Foundation. So we've got this fascinating mix of public, private, voluntary background. And we're going to look at this really challenging environment we have in the world. So donor funding for health is declining. Many countries, especially low and middle income countries, are under terrible financial strain, and we have humanitarian emergencies and conflict around the world. So what we need to respond to this are new models of almost self-organizing voluntary private public partnerships, which bring together the best of industry, of civil society, and of government to meet locally defined priorities and agendas. And I think that the session is going to come up with some really useful mechanisms for doing that, templates almost, for thinking about those things. I think PQMD has a unique place in global health. It's a forum where humanitarian organizations and major diagnostics, medicines, vaccines companies can come together and look at areas of common interest and look at how they work together. It started out with a pretty narrow remit, which was to say, how do we manage gifts in kind responsibly and in a way that maximizes their utility? It's turned into this forum, which looks at the much broader issues of how the public sector and the voluntary sector can work hand in hand. And increasingly, it's looking at tripartite arrangements where those two can partner with government to come up with transformative health programs at a local level, at a national level, and at a global level. But I think this kind of informal partnership structure, where we're not having to sign memoranda of understanding, we're not having to define down to the last paragraph 1A, subparagraph B, section 3, what we're trying to do together, but we're exploring the possibilities. To me, that's the paradigm for the next decade of work in global health. And that's why I think PQMD is so important.